Hello and welcome back. I'm Evan Brand, certified functional medicine practitioner. I've been gone from YouTube for a little bit. The censorship about health topics has pissed me off, and there's a lot of banned words that I still can't say on this channel that I would love to say to help you with specific health issues. So I'll just put a link down in the notes for the video. You can check out a protocol that I've made specifically for long haulers, and I just put out a new podcast as well on the topic, so I will put it there and we'll just get back to regular health stuff. Specific topic today is where your gut pain, digestive pain, is coming from can say a lot about your health. So I want to run you through some of the possibilities that could be happening with your digestive system and how it's dysfunctioning. Now, I've seen over 1,000 cases worldwide. I specialize in digestive and other gut infections. So SIBO, SIFO, parasites, H. pylori, worms, candida, gastritis, other types of gut inflammation, fat in the stool. Gastroenterologists pay me to coach them on some of these natural and functional medicine protocols. I even had a gastroenterologist of 20 years take my Better Belly functional medicine training course the other day and said it taught her more than what she learned in her 20 years of practicing gastroenterology, because I'm coming in from the natural perspective. I'm working on things that conventional medical doctors will maybe never work on. So specifically, let's start up north here, okay? So if you have pain, now it'd be nice if we had a skeleton that we could overlay on top of this, but just imagine that somewhere in this area here is going to be your sternum. Okay, so right in here is where we're looking. Now, if you have pain near the sternum and it goes down to one side of the rib cage, well, oftentimes it'll come down to this low right side, sometimes low left side of the sternum. That could be an H. pylori infection. Now, I did a video on H. pylori before, and I'll link that up here or down below. H. pylori is a bacterial infection. It damages the stomach, specifically the parietal cells, and causes a lot of issues with ulcers, stomach cancer, issues with the esophagus, and many other problems. So if your pain is here, look into H. pylori. We could run a GI map stool test to investigate that. Now, if we go a little further south here, let's go over to this low right quadrant. So now we're over here looking down at yourself, low right quadrant over here. We've got the liver, and tucked right underneath the liver, you see here is the gallbladder. Now, if we pull this out, I'll give you a little more. Let's go ahead and pull out the parts as we talk about them. How's that? So we'll pull the stomach out here. The H. pylori damages inside of this. Right in here, those parietal cells get damaged. So get rid of the tummy. Now we're going to pull out liver, right behind here, gallbladder. Now you could have gallstones, you could have blocked bile ducts, but generally that's going to be a very severe and acute pain. That's not going to be like a chronic pain. So that could be another problem to consider. But issues with the liver are possible. However, generally there's not much pain associated with that. Generally, the pain is going to be more gallbladder related. So if it is in that area, just consider, low right quadrant there, consider liver, consider gallbladder. So we may want to look into running some blood panel. Now let's move further south. We're getting into the digestive system now. Tucked back in here, you've got the pancreas, but once again, I don't really typically see pain with the pancreas. On this low left side, however, is the spleen. So if you've got pain over in here under the rib cage there, that is your spleen. Now that could be linked to an infection called Babesia. Babesia is a tick-borne intracellular parasite, and it does affect the spleen quite a bit. I personally had spleen pain for a long time. You can actually have an enlarged spleen due to this infection. So if you've had a history of tick bites, you may need to run a test. We typically use a urine DNA sample to look for Lyme, Bartonella, and Babesia. But if you have a spleen infection, that would definitely cause pain in this low left quadrant here. But now, moving a little further south to the low right quadrant, we've got our ileocecal valve down in here. So essentially what happens is you have all this small intestine. Eventually the small intestine goes through the ileocecal valve into your colon, which is your large intestine. And now what you're going to have the appendix down in this area as well. So once again, obviously if that's acute and severe pain, that could be appendicitis, which possibly is an emergency situation. Sometimes the surgeons may just give you antibiotics and send you home. Other times they are going to want to remove the appendix. So once again, I'm talking more chronic issues. This is not the acute pain episode. This is more chronic, okay? So if you've had long-term pain in this area, it could be related to the appendix that does have inflammation, but it may not be to the extreme level where you need surgery or removal. Now, when you do get into this ileocecal valve though, this is about halfway in between your belly button and the top of your hip bone. So if you put your thumb on your belly button, you put your pinky on top of your hip bone, right in the middle there, this is roughly where your ileocecal valve is, and I can go right to it every time. I feel it. It almost feels like a little golf ball of tissue, and you can kind of rotate that in a clockwise direction, looking down at yourself, and massage that. Sometimes that can help. There are certain chiropractors that can do certain adjustments in this area if you have pain. We forgot to mention a hiatal hernia. That would be further up here towards the stomach. So if we had liver, gallbladder, stomach back in there, hiatal hernia is another possibility up north. Now moving back down here though, you've got your ascending colon, you have your transverse colon, and then you have your descending colon, which goes down into the rectum and of course out the anus. Now what can happen is these infections, like small intestinal bacterial overgrowth, can start to migrate up north into that small intestine, and you can start to have pain in this area. It can manifest around the belly button as well. So all around that belly button, if you have pain in that area, you want to consider small intestinal bacterial overgrowth, that's SIBO. Now, conventional medical doctors, even gastroenterologists, are getting better about diagnosing this because they are starting to run more breath testing. This is where you blow into a tube, into this bag, and you can measure methane and hydrogen gases. You can then be diagnosed officially with SIBO, small intestinal bacterial overgrowth. But the reality is the rifaximin and some of the other medications that they use, they often have a poor success rate. As you know, there's a big issue with antibiotic resistant bacteria, even antifungal resistant candida. We're seeing that a lot in the conventional medical world, which is why I love what I do with herbs, because we don't have that same issue. So I've developed specific microbiome supports that we use to address that. Now typically we're going from the mouth all the way to the anus. This is one long tube. And so if there's esophageal issues, stomach issues, small intestine, large intestine issues, you can soothe all of this using specific antimicrobial, antifungal herbs. So once again, in this area, if it's pain around the belly button, consider what they call SIBO or SIFO, meaning small intestinal fungal overgrowth. You can also have fungal overgrowth in the gut. The cool thing is with herbs, sometimes the herbs are antifungal and antimicrobial all at the same time. So that's really fun when you can run a urine organic acids test and or a DNA stool test, and we can confirm candida, SIBO, parasites, worms, H. pylori. That's a very common situation I've seen hundreds of times. That was my story. I had H. pylori, I had 2 parasites, Cryptosporidium and Giardia, and I also had a massive candida problem. Fortunately, I was able to resolve all of that. I think this covers most of the areas of the pain. I guess we could talk about some of the radiating pain that could be coming from the adrenal glands or from a back injury or possibly damage to the kidneys from mold toxin. So sometimes these nerves that wrap around from the back here, you may have some manifestation in the front end, but the pain is actually just radiating from the back. So you could just consider that. I'll flip her around here, but you've got quite a lot of nerves in this area that do wrap around the rib cage. So just consider if you've had a back injury here, this is very, very common. Mid to low back injuries are very common. If you've been in a job where you've been lifting weights, or maybe you are a bodybuilder and you injured yourself, or you have a very physical job and you've got pain wrapping around, consider that. Most of the time though, it's going to localize back there. You're going to want to focus on some of these infections. So get the proper testing done. I cover this in my Better Belly Functional Medicine training course. This is for doctors, naturopaths, chiropractors, even people that just want to improve their health. They want to learn behind the scenes about what have I done clinically, what kind of tests can you run on yourself at home, urine and stool and others, and then what do you do with those results. I teach all of that in the course. So there's a free masterclass. I'll link it right here. You can check it out if you're interested. This is Evan Brand signing out. Hope to help you, and take care. Bye-bye.